Hello friends, welcome to my channel Talks MM. Today we are discussing very important topic, that is low back pain, and what are the natural approaches to the prevention and treatment of low back pain. Low back problems account for more than 12 million visits to a doctor each year. 8 out of 10 people will experience low back pain at some points in their lives. Besides the common cold, low back pain results in more lost work days than any other physical afflictions in person under the age of 45. According to a recent study in Scandinavian Journal of Rehabilitative Medicine, nearly 51% of school children suffered from low back pain. Significant risk factors include age, gender, amount of time spent in front of TV, and involvement in competitive sports. In another study published in the magazine Spines, many children experience recurring low back pain. According to the study, the most common cause were thought to be sedentariness, very high level of activity in the competitive sports, low school desk that forces the low back into a forward leaning position. So, what is low back pain? What causes it? And what can you do about it? To answer these questions, let's start by looking at the types of pain that you may experience. Pain in Pain is the body reaction to a signals being sent from an area that has been injured in some way. A message originates from the location of the injury, travels through the nervous system, and it is received by the brain where it is interpreted as a pain. There are different types of pain. These differences are important to understand as they help to determine the types of injury and the best treatment options available. Some pains may be felt as a burning or stabbing pain. This is usually caused by damage to our nerve tissue. Other pain may be felt as a dull, achy or pressure. This is characteristics of any injury to the nerves causing spasms in the muscles that results in muscular aches and pains. Acute pain. Acute pain can be sharp and severe. It may go away on its own or with the application of ice or heat. If it fails to go away, it can develop into a chronic pain. Chronic pain. Chronic pain is a pain of long duration. It may be on and off due to its long-term nature. It usually indicates underlying damage to the structure of the back. This could be damage to the nerves, discs, or muscles. Now that you know about the types of pain that may be felt with low back problems, let's look at some of the more common causes of low back pain. Strains and sprains can be caused by the injury to the muscles and ligaments. The muscles in the lower backs are the workhorses for the whole body and therefore more likely to be injured. They provide the strength for walking, standing, and lifting. Sprains. Sprains can occur when a sudden forceful movement injures ligaments that connects and helps support the bones and joints in the low back. Strains. Strains occur commonly as the result of poor conditioning or overwork of the muscles. When the body is out of shape, it does take much to overwork or even tear muscles. But other factors may contribute to the injuring your muscles and ligaments. Poor posture, long periods of standings, being overweight, structural misalignment. Herniated disc, also called a slipped, ruptured, or torn disc. This condition usually strikes a person in their 30s to 40s. This results in typically a sharp cutting pain, which may also extend into the legs. Before we get into a solution to a low back pain, let's take a look at what we can do to prevent a low back injury to reduce aggravating it further. There are three specific movements that are responsible for most low back injuries: bending, lifting, twisting. Number one, bending. Number second, lifting. Number third, twisting. So a person is usually safe when performing any one of these movements. The danger lies in performing any two or more of them simultaneously. Some simple guidelines to follow are: bend at the knee, not at the waist. When lifting objects, keep the object close to your body and keep the low back straight, not bent forward. Whether you are at work or at home, whether you are lifting or carrying objects, making your bed, working around the house, changing a car tire, or playing with your kids, think before you act. We are now going to conduct some tests to see if you have restricted motion, weak muscle, postural distortion, or problem with your nervous system. Stop immediately if any of these tests can cause you pain or discomfort. Restricted lumbar motion test. Stand up straight with your hands at your sides and your feet at your shoulder width. Bend at the waist to one side by lowering one shoulder and running that hand down the outside of your thigh. Repeat on other side. See in the picture. Restricted lumbar spine test. Stand up straight with your hands at your sides and your feet at your shoulder width. Slowly bend forward and try to touch your toes. Keep your knees straight but not locked. Muscle tightness test. Using a chair for support, lift one leg up behind you and grab on it with your other hand. Gently pull your foot upwards towards your back. Repeat with other leg. See in the picture. Pelvic distortion or postural test. Close your eyes and march in a place for a count of 10. Are you off balance? Do you have to recenter yourself? When you open your eyes and look down, are your feet spread unevenly apart? See in picture. Neurological stress test. Stand on your right leg, extend your arms, lift your left leg, close your eyes and count to 10. Can you hold your balance? Now change your legs and try again. See in the picture. Now that you know a little bit more about your low back pain, the question is, what can you do about it? Many people try to treat their symptoms with medications such as aspirin, ibuprofen, and bed rest. However, these treatments do not address the physical source of their low back pain. Fortunately, over 95% of people who experience low back pain do not have to resort to drugs or surgery to resolve it. There are several physical approaches to these problems which we will now cover. One method to help relieve pain is a technique called trigger point therapy. See in picture. Trigger points are area of muscle spasm or tightness caused by irritation of nearby nerves. These are the trigger points for low back related problem. See in picture. To relieve these trigger points, you will need a partner to help you. See picture. To find the trigger points, use your thumb, the palm of your hand or your elbow to locate the exact area of tenderness. Now press and hold the trigger point until it becomes less painful, not until it is gone. This should take 30 seconds or less. Daily treatments to relieve trigger points can help reduce stress and pain in the body. Another breakthrough technique is used by chiropractors, medical doctors, osteopaths, and physical therapists alike is traction, such as a Spine 8 Track Sport 2000 ambulatory traction device. You can see. A Spine 8 track was developed for the prevention and treatment of low back condition. This traction device uses weight-bearing extension traction technology to instantly relieve low back pain and muscle spasm, decompress lumbar disc, relieve pressure on irritated nerves, increase low back stability, increase circulations, and shortness recover time. The Spine 8 track has been tested and proven in many cases to be 90% effective in relieving low back pain. Listen to what one patient had to say about the new treatment. After seeing many of doctors for my low back pain and leg pain, I was beginning to think I will have to live with it for the rest of my life. After just 10 treatments with the spiny track. I felt tremendous relief. I can live a normal life again. This is a John Henderson, a patient. Also, regular exercise can help restore the strength of your back and gradually return you to your everyday activities. Here are some basic exercises that you can do to strengthen your low back pain. You should always consult with your healthcare provider before starting any exercise program. Once you are comfortable with these lower back strengthening exercises, your healthcare provider can give you more advanced exercises. Postural exercise. Sit in the extreme slouched position. After a few seconds, slowly draw your back up straight and arch it. Then relax the arch in your back about 10% to find your correct posture. Work up to using this position as your normal seated posture. See in the pictures. Full back release. Sit in a chair with your feet flat. Relax your shoulder and keep your head level. Relax your neck and curl your neck, upper back and lower back slowly forward until your hands touch the floor. Hold for 10 seconds, slowly strengthen to your correct seated positions. Standing back extensions. Stand with your hands on your waist, finger pointed towards your spine, bend backwards at the waist. Avoid excessive bending. Hold for 5 seconds, rest for 5 seconds, repeat 5 times. Look at the picture. Side bending exercise. Stand up straight with your hands at your sides and your feet at shoulder width. Bend at the waist to one side by lowering one shoulder and running that hand down the outside of your thigh. Hold for 5 seconds, repeat on the other side, repeat 3 times. See picture. Rotational exercise. Standing straight with the feet apart at shoulder width. Clasp your elbow in the front of you. Rotate slowly and rhythmically from one side to other sides, increasing the degree of rotation as your tolerance increases. Walking, the best exercise. Walking is probably the best overall exercises for back and body health. Pay attention to your posture when you walk, and the proper swinging of the arms help in improving proper back function. If you failed any of the earlier tests or if you had difficulty with exercise, it likely indicates that there is a physical problem. Have you ever had a pebble in your shoe? Sorry, pebble. Since low back pain is a physical in nature, it responds best to a physical form of treatment. Chiropractic care, which includes correcting postures, relieving pressures on the nerves and discs, and fixing injured muscle, has proven to be an effective method for handling low back pain. In a survey conducted in 2002 by a media journal research, 42% of the participants had experienced back pain within the 12 months. According to the survey, chiropractic was rated the number one natural health care choice. 95% who saw chiropractic rated the effectiveness of the chiropractic as being the satisfactory to excellent. And according to the recently released USA guidelines for patients with recent onset low back pain, chiropractic treatment was rated the most effective. A study released by Ontario Ministry of Health and published in USA Today cited the best clinical studies show that spinal adjustment is more effective, safer, and more cost effective than other conventional treatment for low back pain. In case of study published in the Journal of Manipulative and Physiological Therapeutics, a patient suffering low back pain from lifting heavy boxes experienced no relief from taking aspirin and brufen for a period of 3 weeks. After one chiropractic adjustment, the pain was gone. So chiropractic adjustments are effective in treating low back pain. Chiropractic technique is not only effective, but it is considered a gentle, non-invasive procedure comfortably tolerated by patients. Many people are unaware that doctors of chiropractic is required to complete an education very similar to that of a medical doctor. Chiropractors are trained in pre-medicines, then 4 years of chiropractic college, and are licensed in all 50 states like the curriculums of medical schools. A chiropractor's education is devoted to us scientific subjects such as anatomy, biochemistry, microbiology, pathology, public health, diagnosis, and clinical disciplines and health sciences. Because chiropractors work with their hands and are trained to find and correct physical conditions through a form of physical treatments. So they are used by some of the world great athletes and entertainers.